Welcome to the Jackson County School District 2018 Annual Open Enrollment Employee Benefit Presentation. The Jackson County School District is committed to supporting its employee team. As part of this support, we want to make sure you have benefit options that fit both your needs and your budget. Pay close attention. You can pause the presentation as well as replay it as many times as you want to. Take notes of any questions you want to ask during your one-on-one counseling session. And remember, by viewing the entire presentation, you will be eligible to win one of 3 $50 gift cards. The district has selected Taylor & Sons as a partner to assist us with our benefit enrollment process. Taylor & Sons is a Hammond, Louisiana-based firm that provides benefits communication and enrollment services to school systems and other public and private entities across Mississippi and Louisiana. In addition, they specialize in providing the best voluntary benefits plans available in the market. Our agenda today is as follows. Review enrollment objectives and the new process. Review Section 125 cafeteria plan. Review flexible spending accounts, health care and dependent care. And review the voluntary benefit menu, which includes dental and vision, group term life and accidental death and dismemberment, disability, accident, cancer, critical illness, and a new benefit this year, lifetime benefit term with long-term care benefit. Our enrollment objectives are to have a consolidated, simple process that focuses on education and helping you make good, solid, informed decisions in building financial security for you and your family. We will establish a best-in-class benefits menu and facilitate the transition of existing benefits while assuring the district maintains full compliance. Open enrollment begins Monday, October 9th and ends Thursday, October 19th. Each of you will meet with a Taylor & Sons benefit counselor at some point during that time. Please go to www.mybenefitsportal.com/JCSD to schedule your one-on-one meeting. In addition, you may prepare for your enrollment session by reviewing the benefit information available on the benefit portal. If you intend to cover family members, please have their date of birth and Social Security numbers to help you complete your elections. Again, please visit www.mybenefitsportal.com/JCSD to schedule your meeting and review benefit information. Section 125, or cafeteria plans, were established by the IRS back in 1978. These plans allow employers to let employees pay for certain eligible benefit plans with pre-tax dollars instead of after-tax dollars. Eligible benefit plans include health, dental, vision, cancer, accident, and flexible spending accounts. Employees save approximately 20 to 30% on each dollar pre-taxed, with no additional tax later. The IRS does require that you keep your pre-tax benefits for the entire plan year. After open enrollment, you may only change a pre-tax deduction if you experience a qualifying event, such as marriage, divorce, birth, adoption, death of a dependent, or spouse job change. Your flexible spending accounts will be administered by Flex Made Easy. There are 2 types of flex spending accounts available, medical and dependent care. These accounts allow you to set aside money from your paycheck on a pre-tax basis to pay qualified medical and/or child care expenses. Pre-tax means you do not pay federal, state, or FICA taxes on those dollars. On average, if used correctly, you can save between 20 and 30% by not paying taxes on this money. Plan wisely though. Any money you set aside in a flexible spending account must be reimbursed with an eligible expense incurred during the plan year, which is January 1 through 12/31 every year, or you lose it. There is no cost to you for either of these valuable benefits. This slide provides an example of the savings that someone with an annual salary of $40,000 that spends at least $3,500 annually between qualified medical expenses and qualified child/adult care expenses. By setting up and using flexible spending accounts for these expenses, the approximate annual tax savings is $1,050. Specifically for medical reimbursement, 100% of your annual contribution is available beginning the very first day of the plan year, which is January 1st. The maximum contribution you can make to your medical flexible spending account for 2018 is $2,600. To determine the amount to contribute to your medical flexible spending account, you must estimate the eligible expenses you expect to incur during 2018. Some examples of eligible and ineligible expenses include co-pays and deductibles, medical office visits, prescription drugs, dental orthodontic care, vision care, vaccinations, smoking cessation programs, mileage to and from doctor's appointments. Some expenses that are not eligible would be insurance premiums, cosmetic procedures, personal hygiene products, vitamins, supplements, diet products, food, or health club fees. For a more detailed list, go to www.mybenefitsportal.com/JCSD and click Flex Made Easy. A dependent care flexible spending account allows you to set aside dollars to pay for eligible dependent daycare services, generally used for work-related child care expenses. But you can also use these funds to pay towards work-related expenses for older tax dependents who are not capable of self-care. The care provider you use can be a licensed facility or an individual. In either case, however, you will need to provide their tax ID or Social Security number when submitting your reimbursement requests. The calendar year maximum per household that you can contribute to a dependent care flexible spending account is $5,000. Flex Made Easy is very user-friendly and provides you with easy access to your account information 24/7. You may access your funds by utilizing the very popular debit card, or via the online portal, or the old-fashioned way by submitting paper receipts. Once you have enrolled, you may set up your account by going to www.mybenefitsportal.com/JCSD and clicking on Flexible Spending Accounts. Dental insurance by Always Care. There is no change in plan design. You have two plan options, the Platinum Plan and the Gold Plan, and both have an individual lifetime deductible of $100. Cleanings are covered every 6 months for both plans at 100%. Basic services are covered at 80% after the deductible on both plans. The difference between the Platinum Plan and the Gold Plan is that the Platinum Plan includes coverage for major services and orthodontics. In addition, the Platinum annual plan maximum is $2,000 per person, and it's $1,000 under the Gold Plan. Rates for the dental plan have not increased in the last 3 years, even though utilization has been high enough to merit one. After some tough negotiation, Always Care agreed to a 5% rate increase, and that rate increase is locked in for the next 2 years. The new monthly rates are indicated on the slide. Vision insurance by Always Care. The Vision plan includes a $10 copay for an annual exam and $10 copay for glasses. Exams will be covered in full after the copay has been met. $120 retail allowance for frames, $94 retail frame at Costco, Walmart, and Sam's Club. Most lenses covered in full, and contact lenses covered up to $130 retail allowance. Please note the frequencies for frames. There's no rate change on the Vision plan this year or next year. The rates are on the slide. Voluntary Group Term Life and Accidental Death and Dismemberment by One America. Do you have enough life insurance? In the event of an unexpected premature death, do you have enough life insurance to take care of things like burial expenses, income replacement to pay off debts, college tuition, etc.? This benefit provides you with a simple and very affordable way to obtain life insurance during your working years. This life insurance plan allows you to purchase anywhere from $10,000 to $500,000 of coverage on yourself. This year you can purchase up to $125,000 of coverage without any health questions, a guaranteed issue. If you would like to cover a spouse as well on this plan, you can. You can purchase up to $30,000 on your spouse without any health questions. You can also cover children for either $5,000 or $10,000. Once you are enrolled in the plan, you can increase your coverage annually during open enrollment by $10,000 or 10% of your face amount, whichever is greater, with no health questions. This plan is replacing the Unum plan with improved benefits at the same rate. Spouse and children rate includes accidental death and dismemberment. If you have the Unum plan, you must complete a new beneficiary designation form. Long-Term Disability Plan by One America. The impact of a disability is real. Many people believe their biggest asset is their home. However, for most of us, our biggest asset is the ability to come to work and earn a living. Not being able to work due to a disability is often financially devastating. How likely is it that you may become disabled? According to one study, 30% of all Americans between the ages of 35 and 65 suffered a disability lasting at least 90 days. The risk of a disability is real, so the question is, what can I do about it? The answer is disability insurance. With this long-term disability plan, your monthly benefit can be as much as 66 2/3 of your pay. You can do in increments of $100 less than that. The benefit is paid to you tax-free. Depending on the elimination period you choose, your coverage will start after either 7 or 30 calendar days out of work, unable to perform the regular duties of your job. If you are hospitalized, the benefits will begin day one. There is no elimination period. The benefit will pay until Social Security full retirement age, if necessary. Any condition you have received medical advice or treatment on in the last 6 months is considered pre-existing and will not be covered for the first 12 months of the policy. This is waived if you are currently covered under the American Fidelity Disability Plan. This plan is guarantee issued during open enrollment, which means there are no medical questions. Also, the benefits that are paid to you do not offset with sick pay for the first 60 days of disability. Cancer insurance by a loyal American. Why do I need cancer insurance is a very common question. Medical insurance covers some of the medical bills, but not all. Cancer insurance will help with some of the medical bills. There are also indirect and non-medical expenses incurred that cancer insurance can help with, such as traveling for treatment, hotel, meals, etc. According to the American Cancer Society, 1 in every 2 American men and 1 in every 3 American women will be diagnosed in their lifetime. You have 3 levels of coverage to choose from with competitive rates. The most important benefit in this plan, and the benefit you should use every year, is the wellness screening benefit that covers tests such as mammograms, pap smears, PSAs, colonoscopies, etc. If you or any of your insured family members have one of those tests, you will be paid up to $100 per person per calendar year. Other benefits of the plan include radiation and chemotherapy, anti-nausea medication, stem cell transplant, transportation and lodging benefits, surgery, hospital confinement, specified disease, and there's an optional ICU benefit if you want to add that as well. Important features of the Loyal American Cancer Plan include no physical exam required, guaranteed renewable for life. Your policy cannot be canceled by the company except for non-payment of premium, pays in addition to all other insurance. Your premiums cannot be raised unless rates change for the entire class. Your policy is portable. You own it, It goes with you for the same rate if you leave or retire. Accident insurance by Combined Life. We all know that anyone can have an accident. Doesn't medical insurance cover accident costs? Well, the answer is yes. Most health insurance cover major expenses resulting from accidents. However, what about the copays, deductibles, or other out-of-pocket expenses that may occur? That is where a combined accident plan may make sense for you and your family because it pays additional cash directly to you if an accident occurs. With Combined's accident plan, you have 3 levels of coverage to choose from, all with competitive rates. Benefit highlights include under initial care, emergency room, urgent care, ambulance, doctor's office visit benefits, annual health screening, specific sum injury, health admission per day benefits, ICU admission and per day benefits, transportation and lodging if travel is required, accidental death and dismemberment, also includes a first accident benefit, a sports package benefit, and a rehabilitation package. Important features of the accident plan include no physical exam required, guaranteed renewable for life, pays in addition to all other insurance, 24-hour coverage, no annual or lifetime maximum, benefits are paid to you, your policy is portable, you can take it with you if you leave employment or retire. Critical illness insurance by Loyal American. The medical care we receive is excellent and helps us survive events that used to cause death. A critical illness plan will provide you with a tax-free lump sum payment of between $5,000 and $50,000 depending on what you choose in the event of a critical illness such as heart attack, stroke, major human organ transplant, end-stage renal failure, paralysis, coma, severe burns, and there's a 25% payment for coronary artery bypass or angioplasty procedures. Important features of the critical illness plan include coverage amounts from $5,000 to $50,000, the guarantee issue amounts, meaning there are no health questions during this initial enrollment period only, the employee up to $30,000, spouse $10,000, and your children up to $3,000. The benefit includes a $100 annual health screening benefit. There's also a reoccurrence benefit for multiple events. The rates are competitive. Permanent term life and long-term care plan by Fidelity Life Insurance. This is a brand new benefit option for you this year. This plan helps you address 2 needs, the need for life insurance and the need for long-term care protection. Life insurance with guaranteed rates to age 120. Guaranteed rates to age 120, portable and individually owned. Other group life coverage decreases with age and premiums increase. The long-term care protection under this plan also goes to age 120. It pays a benefit of 4% of your face amount monthly for up to 75 months. Also includes an accelerated death benefit for terminal illness. 50% of the face amount will be advanced if you're diagnosed with a terminal illness. This is the most economical and easiest way to buy long-term care coverage. Some highlights of this coverage include, for you the employee, it is guarantee issue up to $100,000. There are no health questions. For your spouse, as long as you buy a policy as well, it's guarantee issue up to $25,000. Your spouse can purchase up to $75,000, and there'll be 4 health questions involved with that. Children or grandchildren are guarantee issue as well for up to $25,000. They can also be added to your policy as a rider. Once you are enrolled in the program, you have a future purchase option, which basically allows you to increase your coverage annually up by $25,000 with no health questions. Payroll deduction information. Pre-tax products include dental, vision, cancer, accident, and both flexible spending accounts, medical and dependent care. Post-tax products include life, disability, critical illness, and the permanent term life with long-term care benefit. An example of some qualifying events, change in legal marital status, change in number of dependents, change in employment status, gain or loss of coverage, change in status affecting dependent eligibility. Remember, key information is available to you at www.mybenefitsportal.com/JCSD. Please go to that benefits portal and click on the enrollment scheduler and schedule your benefits enrollment meeting. You can also find benefit brochures and customer service forms, flexible spending account information, Flex Made Easy, links to some of the company websites, and a link to an EverFi financial wellness program. In summary, our benefits counselors are non-commissioned and will provide you with unbiased advice. The following benefits will no longer be available through payroll deduction: Allstate accident, cancer, critical illness, and American Fidelity disability. If it is in your best interest to keep any of those policies, you can convert to individual pay. We can provide you with the appropriate form, or you can contact the agent. As far as Group Term Life, One America is replacing Unum. You must complete a new beneficiary form if you currently have the Unum plan. New certificates, policies, and/or ID cards will be mailed directly to your home for any new or revised benefits. The plan effective date is January 1st, 2018. Well, you've made it to the last slide, which means you're eligible to win one of 3 $50 gift cards. Congratulations. Thank you very much for the opportunity to assist you in your annual open enrollment. We consider it a privilege to serve you. Have a great day.